This is the part where you introduce the podcast.
I always introduce it. Why don't you introduce it?
You're right. This is a very special episode. Hello, everyone. Welcome to today's episode of Hubris, the highly unsolicited book reviews for invested spouses.
There you go.
My name is Mark.
My name is Jess.
And today we've got a very special takeaway for you. Today we're going to talk about one of my books. That's right. I have had one of my latest obsessions, which is basically a fun way of saying I'm hyperfixating on one thing recently, and I've really been enjoying it. And happens to be a book, so I thought I'd talk about it.
Yeah. And I have not read it, so this is Mark's baby. So the roles are fully reversed today.
Yes. So today we're going to be talking about a book called Outlive. This is The Science and Art of Longevity by Peter Attia MD. So Jess has been hearing me tote on and on about this, but
I feel like I could tell you what the book is about based off of the
all right, hit me. Give me the TLDR right now, and then we'll jump into my thoughts.
So this guy was a cancer doctor, or studying to be a cancer doctor.
Uh-huh.
And while he was studying, he, was seeing patients being diagnosed with cancer, and he really wanted to talk about prevention with his superiors. And they basically didn't agree with his philosophy, so he left being a cancer doctor, and he went into statistics. And while he was studying statistics, he helped predicted the last crash that we had.
The 2008 financial crisis.
Yeah, and so again, he's like, by then it was too late to do anything, so he got really gung-ho about the idea of prevention, and he's like, okay, let's look into the science behind preventing diseases like Alzheimer's and dementia and heart disease and all the big ones that tend to affect our society. Mm-hmm. And he basically discovered that eating good and sleeping good and exercising, and I think something about mental health, all those combined would make it so that you will have a higher statistical chance of not getting these diseases that often shortens the life of a person.
Yeah, I mean, that's pretty much it. Like, you nailed it. That was an excellent summary of the book. Yeah, I feel like we're done. Honest. Hey, listener, thank you for tuning in.
Hey, I didn't even read the book, and I was able to summarize it.
I guess it just goes to show how much I've been word vomiting this at you.
Yeah.
Yeah. No, it was a really good book. I kind of came across this guy by accident. I was trying to, every once in a while when I'm at work and long days, in the lab, sometimes I don't necessarily just want to listen to music. I want something that's engaging, but I can still focus on the task at hand. So I put on a podcast, right? Mm-hmm. But I can't remember where I heard of this guy. I think honestly, it was just like I was on YouTube Shorts, and it just like, I was on like basically equivalent of TikTok, and it's just like a little 2-minute interview of this guy, and he was talking about exercise or something. But what I appreciated was he was talking about the biochemistry. So normally when you get like a YouTube short or something, people don't talk in scientific terms. It's always just more general. But he was trying to explain some serious, like, in-depth, high-level biochemistry to a general audience. So I thought, okay, that's kind of interesting. And then I, moved on. Like a month or so later, I was, looking for a science podcast to listen to, and I saw Peter Attia, and I said, oh, crap, I think that was the guy, so I looked at his podcast. He's got a podcast called The Drive, and he interviews like doctors. So he interviews like the head of Harvard cardiology, and he interviews like the head of cancer research at Princess Margaret, and he interviews these people and he talks about these ideas with leading experts. So when I saw that he was actually, having conversations with, not because again, you never really know, right? It's like this guy could just be a guy who says he's an MD, but he dropped out and yada yada, and he just hates the system, and he's kind of, you always got to keep your hackles up. You kind of have to go in with a little bit of criticism, like, okay, are you preaching something? Are you selling something here, or is this like, is this some good advice?
Yeah, well, I think with everything that happens in today's world, with social media and Google being at our fingertips, you really do have to check your sources, because who knows who's
oh my god
talking.
Side note, another book I think I would be cool to talk about, called The Chaos Machine. I read that one when I went fishing with my dad. It's about social media and how their algorithms work. Crazy. Absolutely insane. But we're going to go back to this. So I started listening to some of his episodes of his podcast at work, and he's talking about like nutrition, like nutritional biochemistry, and how he's talking with like leading experts about how do you optimize the amount of protein in your diet, and like, for a normal person, the average recommended amount of protein is insufficient, and the science seems to indicate that, but the average number is the average because it's average, but like the average person isn't healthy in the United States. Like 40% of people are obese. So that was the other thing that he takes umbrage with, is that a lot of these statistics, like when you get your blood test, when you get your, your blood tests done, apparently, they're from pediatric or health, like averages of the population that are pooled, and they aren't necessarily good averages, right? So it's if the biomarkers for diabetes and heart disease, even if they show up normal on the scan for a routine blood test, there are things that clearly show indications of risk for these things that happen 10, 15 years, 20 years, 30 years before you have any indication of anything else. But there are other things that show warning signs that don't really get addressed, and they fall under these quote unquote averages, where it's like maybe this one number looks normal, but if you look at these 2 or 3 numbers combined, you can see warning signs. And so I just thought it was interesting, because I'm like, okay, well, so then when I found I was listening to his podcast, I was really enjoying it, and then I saw he had a book, because what I was really trying to get at was, I was like, okay, well, this guy obviously seems to have some good ideas. I wonder if he wrote a book. So I just looked him up, and yeah, he has a book, Outlive, The Science and Art of Longevity. And it kind of pulls all of the ideas and the purpose behind his podcast, which is The Drive, which he's been doing for many years, and kind of pulls it all together with, he ties it together. He tells a lot of stories, so there's some anecdotal stuff in it, but he does a good job with the research aspect, where there's research articles, and there's recent publications and current leading opinions in the field. And as a scientist, I appreciated reading that, because it kind of helped me. I could understand the scientific part of it, but I also was able to kind of resonate with the concepts a little bit deeper.
Right.
So, that was just kind of like my introduction to it. But, he breaks it into 3 parts, pretty much. He talks about some generic, I guess you could call them like an introduction, right? So he's talking about, he defines 2 different types of death. He basically says there's a fast death and a slow death, right? And it's like most people have, and when they have like events happen to them, it's a fast death, which is like a gunshot or, a car accident.
Yeah.
Exactly. And those are the deaths that medicine is really well equipped to handle. Like people who are trained to be surgeons, they train in cities and they see knife wounds and they see gunshots, and they're trained really well to patch things up in an ER. But the slow death, which is diabetes, he calls them the 4 horsemen. They are diabetes, heart disease, Alzheimer's or other dementias, and I'm trying to think what was the 4th. Cancer. course of cancer. And these are called slow deaths. And basically they kind of creep up on you, and medicine isn't really equipped to handle them very well. We deal with them when they occur, but these types of conditions are chronic and should be, in his opinion, treatment should start for these as early as possible to reduce the risk of what they could be later. If you show signs that you might be developing diabetes, you should address them 10 years before you develop type 2 diabetes. Sounds logical. So on that,
And like we do have to, I think, preface too that some of these conditions are genetic. Like you can live the healthiest life and you can still, develop cancer. You can still be diabetic. You can still, develop some kind of a dementia or Alzheimer's later in life. So, to a certain extent, some of this is not for everybody, right? You can't read this book and be like, well, if I just do X, Y, Z, I'm going to have the best life, right? This is just the best chance at, not getting those, as he called them, 4 horsemen of, I guess, slow death.
Well, they're like they're the 4 leading
horsemen.
causes of death, right? Like heart disease is 1, cancer I think is like or cancer and is 2. We have an or no, maybe not 2, but cancer is way up there. We have a epidemic of Alzheimer's and dementias oncoming with our aging population. And diabetes is linked to so many of these.
For sure. And like, I'm not a medical doctor, so I'm not one to talk, but like, I know that we hear just like to play a little bit of devil's advocate here is, you hear cases all the time of, people who were training to, and have done like multiple like things like triathlons and things like that. So like very, very, very fit people, having heart attacks or, developing cancer and all that stuff. So,
exactly.
These are like the cream of the crop of our, like what we aspire to be, health wise, and, things can still happen, but it's nice to know that, with some lifestyle changes, you're potentially giving yourself your best foot forward.
Yeah, and that's kind of where he comes at it from. Is he actually one of the things he really harps on is when he's talking about assessing risk, they do look at whatever genetic factors you might be predisposed to. So in particular for Alzheimer's, there are genes that are known to have higher risk of Alzheimer's. If you have I think it's ApoE, if you have the ApoE4 gene, you are at like a 12% increased risk. And if you have it twice, because it's a recessive gene, you're at like 30% higher risk or something. Like, granted, it's still 1 in however many people. You're so 20% is but it's a significant risk.
Right.
And so you can have perfectly healthy people that have this double recessive allele, and they are the ones that need to be even more, like it's just a risk pathway. It's like, well, if you're perfectly healthy and you didn't have these genes, we wouldn't have to be as rigorous in trying to prevent Alzheimer's or reduce risk, right? Because we don't have a treatment for Alzheimer's and we don't know the exact cause to date. We have theories, but they're still a work in progress. I'm in the neuro field. I'm something that we're working on. We know that there's amyloid beta, there's tau, there's a combination of these two, but whether they are symptomatic or causal, we don't exactly understand. Is it inflammation that causes it? Is it like we're still figuring it out?
Yeah. And sorry, just to ask, does he address in the book, the fact that historically people don't live as long as we have been, right? So like, the average life expectancy even a couple hundred years ago was significantly lower than it is today, right? Like, your grandparents are still alive. One of my grandparents is still alive. So, this is novel for a 30-year-old to still have, grandparents alive and thriving. So is that addressed at all in the book?
Yeah, he actually in a roundabout way. It's not directly addressed in how this aging thing, like it let me put it, it is addressed, but not in as so much like a direct way. Right. He comments on a couple different things, and I think again, part of the thing about this book is that some of it dips into like dogma, right? So it's kind of like he has a way of thinking that he obviously feels very strongly about, so much so that he has termed this idea as medicine 3.0. So he calls medicine 1.0 kind of like Aristotle, the origins of medicine, where we were just trying stuff. We were just like, I don't know, man, let's bleed you. Let's see if we can figure it out. Medicine 2.0 was the invention of the scientific method, where we were actually carrying out experiments and then trial and error and trying to, go with what worked in a more structured way,
right.
That leading all the way up to antibiotic development, insulin development, like drug development, and current medical treatments. But in his words, basically, he describes when he was in medical school, he kept having this recurring nightmare where he was standing at the bottom of a building and eggs kept falling off the building, and he was running around frantic trying to catch all the eggs, but inevitably he couldn't catch them all and they would crack and break on the ground. Obviously this is an allegory for his cancer patients, right? And so they would have a very successful complete resection of a tumor, and the patient would die within a year because that was the average life expectancy for somebody who had that degree of cancer. Even with successful removal of the cancer surgically, at that point the cancer had probably metastasized. It was somewhere else. It was in their liver. If the cancer is localized in an area in an organ that you can cut out parts of it and it's fine and it's not so essential, survival rates are high. As soon as it metastasizes, survival rates drop off precipitously. And they don't even, that was the other thing he was talking about, they don't even give data for anything more than a 5-year survival rate because they can't, because people don't live that long. So with the exception of a few studied and very easily treated cancers, in particular, he was getting very frustrated because he's like, we're saving these. Yes, it's worthwhile to save a person's life, but could we have done something? Maybe we couldn't, but could we have? And when he started asking those questions, he basically was getting shut down because they're like, we can't give people false hope.
Right.
So he's like, well, that's not a good enough reason not to pursue this line of thinking, right?
It's not. And to a certain extent, like, just hearing you talk, like, a lot of the times when people disagree with medicine in some way or have some kind of philosophy or critique about medicine, it's not usually about prevention. It's more like, well, what else could I have done, right? And so that's when, like, more older medicines, though, like that predates Aristotle and not Plato. Oh my God.
Yeah, sure.
But yeah, all of like the more
Pliny the Elder.
Well, like the whole, when they didn't know anything about the human body, so they were paying grave robbers to dig up corpses. That's a part of medical history, right?
That has happened up until very recently. Actually, I think there is still a black market for it, to be honest.
Yeah. So like there is a darker history to medicine, and
check out the Sawbones podcast. They dive into a lot of that.
Yeah. And, there is, there were things like, for instance, using ginger for nausea or willow bark, before Tylenol really became a thing, right? Like there was things that were tried and true. One thing that I have heard the history of, I am a history major, and I actually took a course on the history of medicine and a few other things, but the history of medicine was really, really interesting. And one of the unfortunate things is midwifery as a practice. Once upon a time, midwives were the golden standard for healthy and safe deliveries, and then the medical field kind of took over, and we lost a lot of the knowledge that these midwives had. And although midwifery is absolutely still practiced, the skills that were developed over a significant amount of years, some of that information has been lost. And obviously, you know, infant mortality rate is much lower, and women's survival is much higher than it was, you know, once upon a time. But there is usually, when you're talking about medicine, I find this criticism of medicine that we lost where some of the root of, you know, what used to work prior to medicine.
Yes, absolutely. And again, it's intrinsic in the system. One of the things he talks about is there is no insurance code for prescribing a specific exercise regimen to a patient, right? Like using science, saying, hey, for you should have this much exercise at this intensity, this many days a week, and we're going to monitor these biomarkers, or this specific, you know, we're not just going to look at BMI, we're going to look at, you know, what is your muscle percentage, and we're going to look at your protein levels, and we're going to make sure that you're actually healthy, right? And it's like, well, there is nothing like that right now that is supported by the system, right? So that kind of leads into what he calls medicine 3.0, which is we're approaching, because people are getting older, and that hasn't really happened. Our bodies were, you know, for years, for millennia, our bodies were evolving to the point where we could absorb as much fat as we could.
Right.
And
well, yeah, because people were starving.
And
there wasn't enough food.
Exactly. And we also were at a point where we needed to, like, our genes did not prepare us to live to 60, 70, 80, 100. So we're approaching an age of chronic disease. And part of it is because we have a society that is, everything in the society is built, like, we have technological marvels that weren't available, and have made many of the discomforts and many of the challenges that our bodies used to face, and has removed them.
Right.
And so this is something that he actually kind of talks about as something that's important, is that our bodies were designed to undergo periods of stress. And stress in the sense of, like, you are not supposed to always be content. You should be hungry. That is a normal thing, and actually is good for your metabolic health.
Right.
So this is one of the things he talks about in, like, nutrition. So again, I'm getting a little ahead of myself, but so in the introduction, he's kind of talking about that, but he breaks it into 3 parts. Part 2 of the book, he kind of tackles, like, the 4 horsemen, as he calls it, and then some big ideas that he kind of like builds his case.
Right.
The first thing he talks about, which I thought was like, okay, like, it turned out to be a chapter, but I came into it very skeptical because it was one of the first things he was using to build his case. He basically was looking at centenarians, people who've lived to be 100.
Right.
And he was like, if we're gonna, understanding that this is an extreme case and that these people are at the fringe of why did they live to 100? Like, we should understand that as a starting point. These people are the pinnacles of, like, longevity. And many of the people who are centenarians they can still move, they can still get out of bed, they can still dress themselves. Like, these are things that people lose as they age very precipitously after a certain point. And for some reason, a small subsect of the population can do it. And that subsect of the population they are all different. Like, some of them still smoke. Some of them eat nothing but steak. Some of them drink nothing but Dr. Pepper. Some of them have never exercised a day in their life. But something about their genes or whatever has caused them to live this long. So they're good, you know, they can only get anecdotal information, but he builds this case of, like, looking at centenarian studies, we can see that effectively all of them are metabolically healthy. All of them are of excellent body, usually of, like, good, excellent body percentages in terms of, like, muscle mass versus fat versus etc. And they usually have good, like, heart health, and they don't have other chronic conditions. So if nothing else, in order, like, that is, like, what, you know, that's that says something. Right. He then gets into, like, I won't go through the whole book, but he basically gets into things like like I was just saying, one of the chapters is called Eat Less, Live Longer, the science of hunger and health. So he talks about studies in animals, because nutritional studies in humans are impossible to do. And the idea is if you take two, like the basic study that's been repeated over and over and over again, is if you take two populations of mice and you put one of them on a calorie restricted diet and you put the other one on a ad libitum diet so they can eat as much as they want. The ad libitum diet, mice pretty much, A, they develop diabetes, but B, they die at 50% higher rate and much earlier than the ones that have, calorie restriction.
Interesting. Well, I don't know. I can't help it when you started mentioning that. My brain went to a goldfish, and I'm like, you can limit as much as a goldfish eats and give them the best tank and whatnot, and they're still probably gonna, not live past a few years. So
yeah, so that's the limit of animal studies, is that animal metabolisms are different,
right?
But this kind of study has also been repeated in monkeys, which are a lot closer to humans,
right?
And it still holds true.
Interesting.
But one interesting thing, and it was in one of the later chapters I read, this is the whole thing about nutritional biochemistry. Like, this is the thing about nutrition. Nutritional science is so I don't want to say misguided, but because, okay, imagine this, like you want to do a study on a Mediterranean diet.
Yeah.
How do you enforce that diet? You can't lock people in a room.
No, but you could,
you give guidelines. You
can ask them to do diaries, and if they don't follow it, then they disqualify for the study.
But then nobody would be in it because compliance is incredibly difficult. It's already hard in a drug trial to get people to take a pill every day and remember to do that.
Right.
People drop out of trials all the time because they forget a dose and they're like, oh, well, we can't.
I was in a trial.
Exactly. Compliance is so hard, especially for things like diet. Like, how are you going to stop somebody if they just want to have a little bit of ice cream? You know what I mean? Like, or they go out for dinner. They have a birthday and they're out for dinner and they're supposed to be in this study.
I know, but do you know what this is? Like, this is the part where I take issue with these types of things. Like, you could work out every single day. And maybe this is coming from, my own medical history. I do have some chronic conditions. And I remember speaking to my rheumatologist, and we were discussing medicine options. And I was told that injections were kind of my only option. And I had said to her, it's like, what if I cut out dairy? What if I do, what if I make these lifestyle changes? Would that help? And she said, this is not something that's going to go away. It's just going to get worse. We don't know why I developed it. And arguably, I started developing it when I was at my healthiest. So we can't say that it was because of X, Y, Z. Mm-hmm. I was a healthy, young individual when my symptoms started showing. And, she said, obviously, yeah, you can, exercise more, you can, eat a certain way, but ultimately, the only thing that is truly going to make sure that your condition does not worsen is medicine. So
yeah, and that's the thing. He doesn't advocate for no medicine either.
Yeah,
like that's the really important thing, is that he absolutely is a proponent of using the tools that we have.
Yeah, but right? I guess my point is that something like this can only truly help people who, are otherwise healthy and are just likely looking to stay healthy.
I disagree with that. Because for example, the chronic condition you have is an autoimmune condition. That autoimmune condition may not improve by eating healthier and exercising, but having this autoimmune condition puts you at higher risk for other things like heart disease, because it makes it more difficult to exercise. It makes it more difficult to eat healthy because you're tired all the time. It hurts to, get up and go get groceries. It makes everything else harder. Mm-hmm. That disproportionately puts you at higher risk for everything else. Yes. So, exercising, it would still benefit you to avoid these other, horsemen, as to look at to use his terminology.
Right.
So yeah, I think it's not this isn't necessarily for people who are already healthy, in my opinion.
That's the impression that I got every time you talked about it. So
yeah, no, he's talking about, like, because again, he's a doctor, so he's treating his patients basically according to this,
right.
And he says a lot of his patients come with diabetes, and they come with heart disease, and they're 40 years old or 50 years old, and they already have these things,
Right.
And he's like, okay, we've got 10 years to fix this, or you're going to have a heart attack, or you're going to be at high risk of developing Alzheimer's, or you're definitely going to be insulin resistant, and that causes a whole bunch of other problems and can also increase your risk of cancer. So let's get your diabetes under control today.
Right.
And it requires, if you're at a progressed stage where you already have a condition, his treatment regimen is very aggressive. He's trying to, if he can get somebody early, that's what he hopes for. But usually by the time he has his patients and he sees them, if they're being referred or something, they're older.
Right.
So, but one of the things I just wanted to jump back to while it's on my mind was that monkey study. So they did the same monkey study, 2 different labs. This is a large study, lots of monkeys. So it's a really good study. The first study showed the same thing as the mouse study. Calorie deficit, monkeys live way longer. Like, it's not even, you can't even compare it.
Right.
It's stunning how much the difference is. Same study gets performed at a different lab. No statistical difference between the 2 groups.
Really?
One group overeats, the other group is fed at a calorie deficit. Then they look closer at the studies. And what they realize is the first group was feeding generic monkey feed. The generic monkey feed is 28% sugar. The other group has a special dietitian that's giving them a balanced raw diet full of proteins, vegetables, same calorie idea, but they're not eating nearly as much processed sugar.
Interesting.
And even the ones that were overeating with the raw, unprocessed diet, there was no statistical difference.
So I can overeat as long as I'm overeating broccoli.
Yeah, pretty much. Pretty much. Now, you can still overeat things like fats, right? But this is the part of the problem with, and this is what he points out, this is the issue with nutritional biochemistry, because all human nutritional studies, for the most part, are like these large scale, like, they basically ask a bunch of questions. They basically say, here's a list. They give questionnaires that ask people what they've eaten for the last 2 years. And they are asked to write down everything they remember eating in the last 2 years. And it's all based on this data, which is like, can't even remember what I ate 4 days ago. You know what I mean?
Yeah.
So how reliable is the data? Not very reliable. And so what they do is they pool huge amounts of data and they try and find correlations between things. They say, well, the people who tend to be obese tend to have answered these questions on the questionnaire, so there's maybe a causality there. But these studies cannot, by definition, distinguish causation and correlation. So their usefulness is incredibly limited.
Right.
So all we have are the animal studies. And the animal studies are pretty clear. If you're eating high amounts of sugar, you're going to get diabetes and die faster. If you are eating at a calorie deficit, at least if you're having a diet that has sugar in it, you will live longer. And so...
It doesn't have as much sugar in it.
Yeah, if it doesn't have as much sugar in it. And so from there, he kind of talks about the idea of abundance. We live in a world where we have technological marvels. We have cheap, high calorie density food that is relatively safe. Like it's not diseased. It's not, like when you go buy bread at the grocery store, it's
you're not buying moldy products.
You're not ingesting bad food anymore. Right. And it is incredibly abundant. Mm-hmm. That has never happened before the Industrial Revolution. Our bodies are not built for it.
Right.
So he has a whole chapter on that. And he also talks about like heart disease. So he goes on to talk about like what are the causes, what are the biomarkers, how can we follow it, and he does the same thing for cancer, and he does the same thing for Alzheimer's, and he does the same thing for diabetes. And he really, part 2 of this book really built a very strong case for me for like, okay, I can see where you're getting at. The science, we've done studies, they seem to indicate that there are things we can do. What are those things? And that's part 3 of the book. So he's talking about building a framework of how to reduce risk and how to, because again, he's not saying you won't get this stuff. Mm-hmm. But he is saying we know enough to know how to reduce your chance of getting these things.
Right.
And he kind of lists them in order, most important to least important. And I'm going to say the list, and it's going to sound like the most obvious thing in the world. But the reason I really appreciated this book is he actually goes into detail about not just saying these are important, but exactly what do you need to do under each of these categories in order to reduce your risk by a significant amount. Not just saying, oh, hand waving, do this, do that. And it is exercise is number 1. In any situation, under all of the studies that have been done on humans, exercise is more effective at reducing your all cause of death rate. So your risk of dying by any cause, by if you're in the top 5 percentile, it's like a 50% reduction of dying by literally anything. It's crazy. There's not a single medical thing, according to him. There's no drug, there's no treatment that has that success rate.
Right.
Especially not for all cause. Mm-hmm. And he goes into a lot of detail about exercise and what kind of exercise you should be doing, but it's really, really good.
Spoiler alert, it's a lot.
It is a lot. He basically breaks it down where there's a thing called zones, apparently, for exercise. So it's like zone 1, zone 2, zone 3, zone 4, zone 5. Pretty much just says, like, you need to be doing zone 2. It's like if you're exercising and it's hard to talk, like your heart rate's up, but you're not, like, burning, your muscles aren't burning, but it's hard to carry on a conversation, that's what you need to do. And you have to do it 4 days a week for 45 minutes. And then you have to do strength training, and then you have to do stability training on top of that. But again, this is, as I said, he's very aggressive with his treatment. He talks about nutrition. Nutrition's number 2. I won't go into the whole details, but basically he breaks down carbohydrate, fat, and protein requirements, and then it leaves it up to the reader to decide how they want to work that out. Mm-hmm. Number 3 is sleep. It is incredibly important. It pretty much is like if your sleep is interrupted, if you have sleep apnea, if you have high degrees of stress or anxiety that's preventing you from sleep, if you're not getting enough sleep, your body is just under stress, and you are at higher risk of everything.
Right.
Number 4 is mental health, for the reasons of it's easier to stick to a program if you're able to have good mental health outcomes, but mental health also is an indicator of stress, and stress is an indicator of stress leads to hormonal imbalances, and high cortisol levels cause havoc on your body. And so getting a grip and a handle on your mental health and trying to get into a peaceful place will also help your body metabolically. And then the last thing he talks about is supplements. He basically said, on your doctor's recommendation, if there are supplements that are worthwhile to take, that would be the last thing that you could do. Try and max out your risk reduction.
Awesome. And women, spoiler alert, if you take prenatals, whether or not you are pregnant or never want to ever have a baby in you, prenatals have everything that you need, as well as a ton of folic acid, which folic acid is fantastic for your skin, for your hair.
It's great for you.
I recommend.
Yeah. Yeah, I mean that pretty much is the book. Like I listened to most of it in an audiobook, and then I liked it so much I bought the book, and probably gonna reread it, to be honest.
Nice.
So.
Well, thank you so much for going in depth in that book.
Yeah, well, That's it's kind of, I don't read a lot of books in the year. I used to read a lot, but this has been my most recent fixation, and I really found it fascinating.
Yeah. And like I should probably, my massage therapist, he's studied a lot of things, and he loves a lot of books like this. So I should probably get some recommendations from him that I think you'd really like, and then
Yeah, I'd love that.
Can talk more, because obviously you're not going to read my fairy smut, like.
No, I'm not much of a fan of reading smut, I have to admit. If it's there, it's fine. I'm not that's not why I like to read. So, when I read like a fantasy novel, I want like the battles. I want to like envision the sword fights. I want to see them. I want to kind of picture what the magic looks like in my brain. I don't really need to think about like who's schlonging who exactly. Just cut to black. Go to the next. Where's the dragons? Where's the next bloodbath? That's what I want. So
in the smut.
Yeah. Oh God. Oh no. Well, listener, we brought it back around to smut somehow. So stay healthy. Again, this is Outlive. It's a book by Peter Attia MD. Big hype for that. So I highly recommend you check it out. Thank you for listening. We try and put our podcasts out every Monday, so look forward to that. And yeah. Anything else to add, honey?
No.
All right. Well, why don't you give us that classic outro that you do every time? It's always the same.
I can't think of one this time.
It's okay. We'll let you off the hook. Catch you later, skaters.